Hello, as many of you will have seen, last week saw the launch of the iMark, an initiative in Ireland to try and reduce the influence of the alcohol industry at community level. It's gained a lot of interest in Ireland and well beyond that. So I thought I'd try and catch up with one of the organisers of the initiative, Paula Leonard from ICANN in Ireland. Hello, Paula.
Yeah, thank you, Phil. I'm Paula Leonard and I am the support worker with the Irish Community Action on Alcohol Network. So we're just 5 years old. 5 years ago, the Irish Community Action on Alcohol Network came about because there was a belief that while we were working on community action on alcohol at the local level across communities, that many of the things that were impacting on alcohol harm actually required sort of larger changes in the policy space or in the legislative space. So we came together, we formed ICANN, and 5 years later, we're now launching, or just have launched, the iMark, which is a mark of independence from alcohol industry influence.
You know, you're looking at the phenomenon at the sort of more of a grassroots level. So community organisations and so forth. Could you give me an idea of how the alcohol industry gets influence over these organisations?
I suppose really it's like anything. There's a story as well as the evidence and the data. So there's the things that were the push and pull factors for us in terms of why now and why this. You know, people will be aware that in 2018, the Irish government adopted the Public Health Alcohol Act, so much lauded at an international level as a very brave and multifaceted piece of legislation that was designed to reduce overall population level alcohol consumption in Ireland, and in particular to reduce young people's access to alcohol and drinking at an early age. So there were two sort of objectives of the Department of Health, and it was a great piece of legislation, but we had very significant lobbying and campaigning, incessant campaigning by alcohol industry interests to either delay, dilute or derail that piece of legislation. And that has been, you know, very well sort of discussed and written up. But what we were finding at the local community level was that in the aftermath of sort of government adoption of that, there seems to be more activity in communities across Ireland. So, you know, the alcohol industry funded school programs in Ireland seem to be stepping up. They seem to be more widely available. And we would be very much proponents of evidence-based and effective and independent schools-based programs. We were seeing industry interests or people aligned with or who have had worked previously in the industry looking for representation on boards in the community and voluntary sector. And we were aware, I suppose, and we were becoming increasingly concerned that a lot of people and organisations in the community and voluntary sector were partnering with or sharing a platform with, or, you know, doing joint events with alcohol industry interests, groups, organisations or charities funded by the industry. So about last year, we just decided, you know what, enough is enough. And really it was about a grassroots response. It was about not waiting for governments, not waiting for state agencies to come up with the perfect solution that could be done onto us as communities. So it's been quite an empowering process as well. And it's very much about saying, well, what can we do? First of all, to make visible the resistance that already exists, because there are several charities in Ireland that are already very well aligned to what we're trying to achieve with iMark. So for example, my own organisation, Alcohol Forum Ireland, Alcohol Action Ireland, you know, those involved in heart health and cancer care in this country, all would have, you know, been very acutely aware of what was happening in the background around the Public Health Alcohol Act and around the misinformation campaigns that the industry engages in relation to health. So it was to make that resistance visible and collective, but it was also then very much about opening up community conversations with those who weren't aware or weren't aligned with what we were trying to achieve with iMark. And we've been phenomenally just overjoyed, I suppose, with the openness that people have had to this. And we've had lots of groups signing up. We already have 10 out of 24 regional and local drug and alcohol task forces have signed up. We already have, you know, very positive feedback from others who want to do that, but there is a process. It does have to go to a board meeting. It does have to be signed by the chair, because for us it needed to be meaningful and visible that the whole organisation was signing up to this. So that's really sort of where we're at, Phil, if that gives you an idea of the journey rather than of sort of the evidence piece. But it is strongly driven by evidence. So that's where we're at the minute in the Irish.
Yeah, I mean, I suppose it would horrify some people to think that that alcohol interest might have a role to play, or have had a role to play in drug and alcohol task forces around Ireland, or indeed any country. So what traditionally has happened in terms of alcohol industry influence in those organisations?
Well, actually, I think it's really fair to say that the drug and alcohol task forces wouldn't have been, there wouldn't have been any issues that we would have really been concerned about. It would have been those drug and alcohol task forces that are members of ICANN that would have come up with this sort of idea originally. So lots of them are really well aligned. But for us, the really positive thing about drug and alcohol task forces adopting this in so many numbers is that they're quite complicated structures. So they have local government interest in them. Some of them have senators and TDs, members of government so sit on them. You have policing authorities, education authorities, health services. So it's more complicated for them to sort of work through and adopt the IMARC. And that's why we said it has to go to task force level, it has to be discussed, there has to be buy-in. And what I found is that it's been a really iterative process, actually. The people who are maybe staff in drug and alcohol task forces were very aware of the issues, but some of the other agencies sitting around the table were very new to this and were very surprised. For example, two of the strategies of the industry really surprised people. They weren't really aware of the misinformation that the industry is peddling in relation to the link between alcohol and cancer. And they were very surprised about the misinformation that exists in relation to alcohol as a risk factor during pregnancy. So the IMARC is much more than a logo. It's also about that process that allows people to look at this in a collective way, because it's a huge topic. Much smarter people than me with, lots of research under their belt have written about this in a very expansive way. But what we were trying to do was to democratize that evidence and to give it to people in sort of bite-sized chunks and say, here, if you look at the overall picture, this is the overall strategy, the overall causes for concern. And rather than be sort of passive around that, there are things that we can do. And we're at the beginning of the journey of the things that we can do. And really, I suppose it's slightly exciting, and there's been huge global interest in this as well. So
you mentioned schools there. I think we shared a tweet, or you shared an interview you did, and you mentioned that alcohol companies or alcohol interests will involve themselves in educating children about alcohol, and you kind of expanded on the, let's say, irony of that involvement. Could you just explain a little bit more about how that operates?
I suppose what we have in Ireland, I mean, we are quite lucky, is we do have evidence-based schools programs on prevention funded and endorsed by both the Department of Education, and the Health Services Executive. So we have a schools-based program at secondary level. But side by side with that, we also have school-based programs, so an 8-week resource that can be used in schools that really is funded by, developed by, and promoted by organisation that takes the majority of its funding from the alcohol industry. And we just have a problem with that, even at the level of just transparency. Do parents know that it is the alcohol industry that's behind the program some of their children is attending? Is it made visible? Are they consenting to it? What's the position of the Department of Education? The Department of Education in this country has shown great leadership and has made a very strong statement and said there is no place for alcohol industry funded education programs in our primary schools. So if the Minister for Education has made a very clear statement about that, what we're saying to him right now, to her right now, because it's a her at the moment, is that if you've made that very clear statement in relation to primary schools, we would like you to extend that concern to include children at secondary school level, which is in the main the age group at which young Irish people start drinking, if they do start drinking. And, you know, maybe it's a tidying up that they need to do. But we're calling on them with and through IMARC to show the sort of leadership they've shown in relation to a policy of non-collaboration with schools in primary.
You mentioned there are alternatives. There are evidence-based alternatives which are offered by, you know, the Department of Education. So what is the lure to a school to provide one which is not, it doesn't have that pedigree? Yeah,
it's a very interesting question. And there's not an awful lot of information available about that. I mean, I do know, you know, we've been told that the industry is in a position, or the industry, sorry, funded organizations are in a position to provide relief for teachers to go and attend their teacher training program. The state doesn't have those sorts of resources. The alcohol industry funded programs aren't in every school in Ireland. They, you know, they run in numbers of schools. We've seen increasing numbers of them. But right now we're just saying there isn't a place for it. You know, we have 6 strategies with the IMARC that we're concerned about. And we've come up with sort of questions, you know, a checklist. So if you're a charity, a voluntary organization in this country, and you're thinking about partnering with the industry, you're thinking about taking funding from the industry, you're thinking about sharing a platform with the industry, here's what we would ask you to go through. Here's your checklist of questions. But when it comes to schools-based education, we're saying there's no place for it. This should be a no-go area. The conflicts of interest are very obvious. We wouldn't tolerate it. We wouldn't tolerate having the tobacco industry in our schools, you know, teaching children how to smoke safely, teaching, you know, about tobacco being a normal adult behavior, showing positive images of people smoking. We wouldn't tolerate those things. And I think there's a low level of consciousness, and maybe that's because of very smart, slick, you know, campaigns by the industry and how it presents itself as good corporate citizens. So, you know, we really didn't want to have a punishment model with IMARC. We really wanted it to be about critical consciousness raising, making more visible the issues, talking about these conflict of interest issues at a community level, in media level, in government level, and that eventually what we're hoping is that we would denormalize having the industry in our schools, and that it would become embarrassing any schools that allow them in the door.
And how would that, I mean, you know, in terms of finding a grassroots support for that idea, I mean, how would that take shape? Would it be through parents' organisations or through schools and schools boards, or is there
what we're hoping is at all those levels. We're going to be talking to, you know, the trade unions. It's a very good place to start. You know, what's their awareness of it? What are their concerns about it? We're going to be talking hopefully to the parents' organisations, but within the local areas where our member organisations are, they're also going to be talking to schools themselves to adopt the IMARC and to say we're a school that is independent of alcohol industry influence. And we're a school that will use trusted sources of information. And we're a school that aligns with the philosophy that children should be, you know, that interventions and prevention programs with children and young people, and we are talking about children, should be from trusted, independent sources. It's pretty simple when you start to talk about it, actually.
Yeah, it doesn't seem to be beyond you know, take a great deal of thinking about. What would be the sort of you know, would you hope to have this IMARC, you know, in every school, and every, you know, you're trying to create almost sort of universal adoption, or is it enough just to as a pressure, you know, a lower level where it still have an effect?
It's almost like, you know, IMARC is sort of becoming a many-headed hydra very quickly. And Professor Tom Baber last week talked about brand stretching. We are ambitious, but we're also rational realists that realise we exist in the charity, community, voluntary space, and capacity and resources are an issue. So in the first instance, what we're going to be doing, Phil, in really simple terms, is each of our member organisations, so there's 14 regional and local drug and alcohol task forces in our membership. We're meeting at the beginning of April, and we're going to set targets for each of our groups for sign up for IMARC this year. And, you know, in some areas that might be large, rurally dispersed, you know, they will set their own targets, because this really is about community change and community driven change. And in other areas, then, you know, they may have more. So one of the organisations that signed up last week was the Dublin City Public Participation Network. They've officially adopted the IMARC. They have 800 member groups. So if we got, you know, even a percentage of those to sign up in year one, we would be really pleased. So it's at the moment, we've only launched last week, so we are being ambitious around it. We will have targets. We will be setting those in April. But I'm hoping that by the end of this year, that IMARC will be recognisable at a community level and at a public level across Ireland. And that we will be talking every day to new people and new audiences. And I suppose with that question, it's a little bit at the moment, watch this space, and we're a little bit early in the process.
That's fair enough. Very wise answer. I suppose, you know, this sort of thing that you'd think that at some point, somebody who's, you know, canvassing for votes might think, well, there's an issue that I could, you know, usefully attach to my campaign. I mean, you know, have politicians shown a sympathy for it, or are they?
Absolutely. We have, because as I was talking about in the task forces, you know, we have had people who are members of government have signed up to the IMARC as part of the task force organisations that they belong to. We've had senators sign up, you know, as part of organisations that they belong to, and some of them have been quite shocked, actually, even though they were aware of the campaigning piece. So they were aware of the industry being in the houses of government and meeting with ministers and the World Trade Organization coming to Ireland and, you know, campaigning. They were aware of that political campaigning piece, but they weren't necessarily aware of all of the tentacles that the industry has across communities in Ireland. And those have been really useful conversations. So one of the things that we're thinking about is, could an individual adopt the IMARC? So we've had numbers of people who are addiction therapists have said, you know, I would like to have IMARC as part of my, you know, service. So we're looking at that at the moment, but absolutely in the run up to our next election here in Ireland, we will be asking people to endorse IMARC, and we will be asking them as part of their campaigning to state clearly what their position is in relation to alcohol industry interference in life in Ireland generally.
I'd be very interested to hear their answers. I'll be watching very closely, because it's maybe not an easy question for some people to answer. But yeah, it's great, this issue. It's something that it's sort of taken my breath away, you know, in multiple levels as I cover this topic. So it's very heartening to see somebody trying to make it, you know, a well-known issue, if not a cool issue. So yeah, it's something I'll be following very closely. So thank you very much for giving us a bit of insight into that, Paula Leonard. Thanks very much.
Excellent. Thank you, Phil.
You're welcome.